Sanitize your hands before proceeding. Assemble the equipment. You will need a basin, washcloths, large ice cubes, and a towel for drying the patient following the application. Check the label on the solution container to make sure you have the correct solution as ordered by the physician. Greet your patient and introduce yourself.
Hello, I'm Dave.
Identify the patient and explain the procedure and purpose of the application. Mrs. Gamble sprained her left ankle several hours ago. The physician has asked the medical assistant to apply cold compresses to her ankle for 20 minutes to help relieve the pain and reduce the swelling. The medical assistant must also instruct Mrs. Gamble in the procedure for applying a cold compress at home. To prepare for this procedure, place large ice cubes in the basin and add the solution to the basin. Using larger pieces of ice prevents them from sticking to the compress and slows the rate at which they melt into the water. Completely immerse the compress in the solution. Go ahead and place additional compresses in the solution to be ready for use. Wring the compress to rid it of excess moisture. The compress should be wet but not dripping. Apply the compress lightly at first to the affected site to allow the patient to gradually become used to the cold. You may want to cover the compress with an ice bag to help keep it cold and to reduce the number of times it needs to be changed. Make sure to ask the patient how the temperature feels, because, as mentioned earlier, individuals vary in their ability to tolerate cold. The application of cold is usually uncomfortable, but most patients tolerate it if they know how much benefit may be derived from it. Repeat the application of the compress every 2 to 3 minutes for the duration of the time specified by the physician, usually 15 to 20 minutes. Check the patient's skin periodically for signs of an increase or decrease in swelling and ask the patient whether the site is painful. Add ice if needed to keep the solution cold. Apply the compress for the proper length of time as designated by the physician. Thoroughly dry the affected part. Sanitize your hands. Review the instruction with the patient for applying the ice bag at home. Check to make sure the patient understands how to do this. Provide the patient with written instructions to take home. Ask the patient to sign the instruction sheet and witness her signature. Sign the instruction sheet with your name and date. Chart the procedure. Include the date and time, method of cold application, in this case a cold compress, location and duration of the application, appearance of the application site, and the patient's reaction. Also chart the verbal and written instructions you provided to the patient for applying cold compresses at home. Make a copy of the instruction sheet to give to the patient. File the original in the patient's chart. Properly care for the equipment and return it to its storage location.